Good afternoon.
I hope you're doing well.
Yeah. Thank you.
That's really nice. Good afternoon to all the people who will be watching our session. Today we have with us Dr. Jagdish, who will be sharing his insights on the topic understanding various mental illnesses. Doctor, can you please introduce yourself with the audience?
Yeah, I'm Dr. J.R. Thapa, ex-professor and head of Department of Psychiatry, Government Medical College, Jammu. Now
Right.
I'm working in my clinic at Roopnagar, Jammu.
Okay, doctor. Thank you so much. So can we start with the conversation?
Yeah,
Okay. So we'll start some with very basic questions first. So,
okay.
doctor, what are the common misconceptions about specific mental illnesses and how can we work to dispel them?
Okay. The most important misconception is that this is a some organic disorder, whereas it is not an organic disorder. It is a personality disorder. In this, all the mental illnesses, there are four areas which are being disturbed: behavior, thought, emotion, and perception. The other areas are the higher functions of the brain, like memory, orientation, concentration, judgment, intelligence, journal formation, abstract thinking. They are all normal. So this is basically a disease of behavior, thought, emotion, perception. There's a disease of personality. So sometimes people take misconception that he knows everything, his memory is all right, ये पहचान भी करता है, ये सबके नाम भी जानता है, सो इसको कोई मेंटल इलनेस नहीं है. ये बेसिक जो है डिफरेंस बिटवीन है कि दिस इज ए फंक्शनल डिसऑर्डर, दिस इज नॉट ए ऑर्गेनिक डिसऑर्डर. So this people should know that their memory and other area higher function of the brain, they are very much normal. The only problem which we observe are in his thought become irrational, unjustified, and his behavior become motor behavior or verbal behavior become abnormal. And the third is emotions. He become irritable, he can become aggressive, and other he can be violent. So behavior is another. So emotion problem, he becomes sad, he can very happy in some, and he can be irritable, and those are behavior issues. And then perception, all our sense organ, there can be a defect in sense organ, like sometimes they hear voices talking to them, that is known as auditory hallucinations, or they see images, that is known as visual hallucinations, or some bad smell or poisonous smell, so olfactory hallucination. So perceptual defects are there, behavior defects are there, thought disorder, but not a organic issues are there. And most of the time when the people hear voices, the people think that this is something magic, this is a magic, some ghost is talking to them, so that they go to faith healer, not to the doctor.
Okay, doctor, thank you so much for debunking them for us. So, moving towards my very next question.
Yeah.
So, are there any particular mental health conditions you would like to tell people more about that people not may know about?
Yes, I think there are major, there are two type of psychiatric illnesses. One is psychosis and other is anxiety disorders. Psychosis में आएगा schizophrenia and manic depressive psychosis, and normally people know it as a bipolar disorder and some unipolar disorder. In schizophrenia, what happened? There is a split of personality. So there is a disorganization of behavior, thought, emotion, perception, and patient loses contact with reality. This is basically schizophrenia, and there are many type of schizophrenia. Let's not discuss that. And bipolar disorder, many depressive psychosis, there is an episode of excitement, violent behavior, excessive talking, overactivity, grandiosity, that is known as mania. And the same person in the second episode go into a depression, sadness, lack of interest in work, appetite is reduced, sleep is disturbed. So that is basically depression. Sometimes this depression, we have suicidal ideas even. and sometimes we call it as a major depression. Sometimes we call it even suicidal depression, we call it. So these are the two main major psychiatric illnesses which we see under the heading of psychosis. The other, if I talk, there's an anxiety disorder. There are generalized anxiety disorder, GAD, social anxiety disorder, then obsessive compulsive disorder. Then there can be a various type of phobias are there, post traumatic stress disorder, and other. They come under the heading of anxiety disorder. If I think, if I talk of anxiety, it's very, very common, right? But people know it. Everybody, whether he's suffering from depression, whether he's suffering from other behavior disorder, they call it, I have anxiety. So anxiety is a very free floating term. Everybody use it. Other they call is a he's suffering from schizophrenia, he call he's in depression. So that terms is used are misnomer. Basically, the disease is something else, and we consider as a layman that whether it is anxiety or only anxiety or it is a depression, which is not true. Now, I would like to talk something more about obsessive compulsive disorder. If we talk about obsessive compulsive disorder, this is a recurrent, irresistible, persistent thoughts, mean ideas, actions, and impulses which are unwelcome by the person. They disturb the person, you see, very much and create a lot of anxiety. Basically, these are unwelcome thoughts, actions, and impulses. This is OCD. But sometimes we say only बार बार हाथ धोना, बार बार ताले चेक करना, बार बार गाड़ी को चेक करना, बार बार चिटकनी चेक करना, यही ओसीडी है. This is not true. This is one part of OCD, and this is known as obsessive rituals. We do rituals again and again. This is obsessive rituals. And the other part of obsessive compulsive disorder is there is ruminations. Rumination means one thought come to the mind. The thought keep on ruminating in our mind, and we think pros and cons of thought. We think ये हो सकता है, ये हो सकता है. We try to solve the thoughts in our mind again and again and again. But that thought mean they remain in our mind and came ruminating. So that is very disturbing for the patient. And if one thoughts goes, another thoughts come. So that is known as obsessive ruminations. Sometime in obsessive rumination, contrast ideas, doubtful ideas also come in mind, that I have done this thing wrong, and they start feeling guilty of it. So that is also a part of obsessive compulsive disorder, and this is come under the heading of obsessive ruminations. These are also known as contrast ideas, or the vague ideas coming to the mind. And the third, the part of the obsessive compulsive disorder is impulses. You have seen people, there is a failure in love, failure in examination, or some there is a loss, financial loss. People in a impulsive behavior, they go for suicide. So suicidal impulses are there, homicidal impulses are there. Then some people start drinking day and night, that is known as dipsomania. Some people are have a compulsive feeling of stealing, that is known as kleptomania. Word is mania, but this is obsession, right? Kleptomania. Some people, they pull their hair, and they have a this urge to pull the hair. This is known as trichotillomania. So these are the impulses which we can see in obsessive compulsive disorder. Many people are not aware about this disease, and they think this is a normal habit, and they don't go to the psychiatrist, and they report to the psychiatrist after many years. I have seen people coming after 5 years, 7 years. eh. So this is, I think, this needs awareness. This disease need awareness that this is a disease, and this is known as OCD.
Okay, doctor. Thank you so much for sharing such great insights and elaborating them for us. So you have had experience of so much, so many years. So you might have come across many different coping mechanisms or therapies or any other techniques that you can tell our audience that could be helpful in managing these mental conditions that you just mentioned.
The first is the sports system should be very strengthened, and the awareness. The Now I think the social awareness is there in by media. There is awareness about the mental illnesses. The person should know what these are the sign and symptom of mental illness, and sometime then they should know where to go. Then the patient should go to the psychiatrist. Sometimes they go to the general physician, their own family physician, or some people go to neurosurgeon. Even some people go to gastroenterologist. Some people go to neurologist. Many people of psychiatric illnesses go to other doctors, which are not real doctor for treating these patients. So the very first thing, we have to recognize that this is a psychiatric illnesses, and the doctor to whom we have to go is the basically this psychiatrist.
Okay, thank you so much, sir. Moving towards my very last question. We do understand that if we are telling to our family members and maybe relatives that we are suffering through something, then that is a very big step for us. So
Yes.
how do you support that statement? That how can our loved ones can help us in going in overcoming those mental health challenges?
I think this is the role of the family and the society, the both. The family, if the early diagnosis is there, the treatment become very good. Prognosis of the disease become very good. Early diagnosis, the family is the first unit of the society. If the family diagnose the person is not eating well, he's not sleeping well, his behavior has changed, he's looking very sad, he become irritable, eh? His face impression has changed, and all expression, how he's expressing the things. He's not meeting the his friends, he's looking sad, he's not laughing, eh? So when the home people, the mother, the father, the brother, the sister, these are the first unit to recognize that this person is having some problem somewhere, and this is a psychological problem. There may be precipitating factors, psychogenic precipitating factors, or there may not be precipitating factors. But the early diagnosis that this person is having some issue in his behavior and thought and emotions, they should go to the concerned doctor. And there is not only medicine, some diseases are mild, there is a reactive type of depression or anxiety. Even the counseling is very very important, psychotherapy is very very important. For depression we give CBT, interpersonal therapies, and a lot of therapies, group therapies are there, family therapies are there. So counseling uh, is also very important with the medication.
Okay, thank you so much, doctor. So that
Thank
was
you.
it from my side.
Thank you
Thank
very
you
much.
so much again for such great insights. I really hope that audience loved it and greatly benefit from it. Thank
Thank
you
you.
so much again